Hi, Nightingales. A question popped in my head the other day, reminding me of a patient I had a number of years ago when I worked in the ICU, who asked me, what do I do if I don't like the physician? I think he's mean to me, but I need him to do surgery on me. Does that mean that he's not a good doctor? And I thought about that for a little bit, and the conversation I had with her went like this. I explained to her that we need providers in our health life for a variety of different reasons. Our longer term providers, like our primary care providers, or providers that work with us for chronic issues, are providers that we should feel safe with to have a conversation, to ask any question, to tell them the truth really about what's going on, knowing that we're going to have a long-term relationship with them and them with us. And in that long-term relationship, you should feel safe asking them anything. You should think that they will listen to you, that they'll give you that extra minute, that they're really paying attention to what's going on and will help you together solve that problem. But for short-term things like heart surgery, brain surgery, something that you're in the ICU with, something that's going to be life-threatening, life-saving, or just going to be a short-term problem, what I told this patient was, we really need this provider for his brilliance, right? This is not going to be a provider that you will have long-term for months or years. Hopefully you will just have this provider for this hospitalization and no more. You'll never see him again. So for this particular problem, we need this provider for their brilliance. And in our opinion, this provider in ICU was a brilliant doctor, a brilliant surgeon. So when I had that conversation with that patient, it really helped them see the purpose of what each provider was going to do for them. So long-term providers can be things like cardiologists, neurologists, chiropractors, primary care providers, things that are long-term that are meant to cover you for your lifetime or as long as you need them. But certain acute providers like heart surgeons, neurosurgeons, ICU doctors, surgeons are meant to be short-term things, not necessarily meant to be long-term. And by long-term, I mean over a year or more. So when a patient asks you, this provider seems kind of short or is in and out for a second, I don't even have time to ask my question, do you think that they're good for me? I would encourage you to have that conversation with your patient. What are we using them for? What is this provider doing for you? Is this going to be a long-term or a short-term relationship? And really, what is the purpose of this provider and their care? Short-term, long-term, acute. And ultimately, they have the right to ask questions, to feel like they're listened to feel like they feel safe in that conversation. And if they're not, I do encourage my patients to get a second opinion. Certainly, in some situations, it may not be possible. ICU going for neurosurgery, ICU going for heart cath or heart surgery or a hospitalist. Always read the room, right? Read the room, see the situation. But you can do that, Nightingales. You are excellent at seeing the whole room, the whole umbrella, the whole piece of the puzzle, and where that fits. But our patient is only looking from the view of the bedside, right? From their own window, from their own eyes, and they might not see the picture as you do. So help them ask questions, help them put in perspective what that provider is for and where that provider fits in their plan of care. Also, I encourage my patients to get a notebook and write their questions down so that when it comes up with me and they want to ask it for the provider, they can write it down in the notebook. They can write it down at night when they're in the bathroom, when they're grocery shopping, when they're cooking, so that they don't forget. Because sometimes it may not be that the provider is intimidating, but maybe that 15-minute visit is intimidating and they don't have time to ask that question. So help them use tools like writing a notebook, writing their questions down that will help them be as proactive and as involved in their visit as possible. Writing questions down doesn't matter whether you're in the hospital or at home going to an office appointment, but it does help the patient feel like they are being interactive in that relationship. So help your patient know how to ask questions, how to approach their provider, and how to put their provider in the scope of what their care is. And I promise you, they will appreciate that minute with you. Inspire and be inspired. And thank you for your service, Nightingales. You are appreciated.